Campbell Christie in 2011 in the Christie Commission report talked about the need for a radical revolutionary redesign of public services in Scotland if we were going to meet the needs of our population. And I think what Ready to Act has become is a societal change movement. The intergenerational cycle, it really encompasses in one place all of the ambitions of Ready to Act, as well as embedding as a key principle the need for us to focus on relationships, compassion and empathy as a foundation for everything that we're doing in our work with children and young people. Where children are experiencing 4 or more adverse childhood experiences, that has long-term consequences for their health and well-being outcomes. So not only does the intergenerational cycle set the foundation for a public health agenda for children's AHPs, it beautifully links together the work that's happening in children and young people services and the need to link with our colleagues in adult services, because the children and young people of today are going to become the adults of tomorrow, and we need to be changing their experiences as early as possible so that they have better opportunities later on and can come out of this cycle of ill health, poor mental health and reduced well-being generally. The intergenerational cycle and the model of collaborative use of resources which comes alongside that have to work interchangeably, and early intervention prevention is one part of that change journey, but it requires innovative leadership and the willingness to creatively destruct things that we might be quite wedded to in terms of how our systems and processes function in organisations. So we can't work with early intervention as separate from discussions around how we're using our resources, the kind of conversations we're having when people make requests for our help. We have to see early intervention prevention as pivotal to the kind of change we want to make, but it has to go hand in hand with a much bigger consideration of what systems do we have, what processes do we have that might be acting as barriers for children and young people accessing the kind of help, support, knowledge and skills that they need to achieve their own wellbeing outcomes. At the heart of all of transformational change in Scotland, whether it's in children, young people services or adult services, is the need to focus on delivering person-centred outcomes. So that means we need to change our conversation from what's wrong to what's important to you, so that we're getting people's perceptions of their own wellbeing at the centre of our outcomes, and that we're understanding what matters to them. We've done probably about 6 pilots of initial conversations training, and what that's enabled us to do is think about the kinds of questions we ask when people ask us for help, the kinds of discussions and conversations we have with them, and really offering alternative destinations for children and young people at the point of request. So for example, signposting them to resources within their community, offering education, reassurance, rather than a traditional model of refer, assess, treat. And what we're beginning to see is some really interesting emerging data that's showing that as you increase early intervention and prevention offerings, and as you change the conversation at the point of request for help, we're seeing that fewer children are requiring to be stepped into specialist level services, although that would always be available to them as and when they need it. We need to get better at systematically collecting and analysing data and understanding our demographics so that we know how best to use the resources we've got available to us in the most effective way to meet the needs of the children and young people that are requiring support from us. It's no longer okay to carry on with a traditional way of service delivery. It isn't going to achieve the kinds of wellbeing outcomes we need to see in the population of Scotland if we're going to interrupt the intergenerational cycle of poverty and deprivation, and enable people to take responsibility for the wellbeing outcomes they want for themselves and for their children. We need to think about what processes and systems we have in place currently that might be getting in the way of children and young people accessing help and support. So for example, eligibility criteria. I'd really like us to be thinking about who are eligibility criteria for, Who do they serve? Are they really gatekeeping mechanisms for overstretched services who haven't been able to release capacity into early intervention and prevention supports? And I'd really like us ultimately to think about, can we do away with eligibility criteria so that we're seeing every request for help as appropriate, and really putting the onus on us to start thinking about what are people asking help for, what do they need from us, and thinking about non-traditional approaches to that. All of this transformational change requires us to think about the relationships we have with children, young people and their families, and the relationships we have with each other. The kind of collaboration we're talking about is compassionate and empathetic dialogue and discussion about what matters most to children, young people and their families, and a move from therapeutic outcomes to child and family focused outcomes. So what's important to families and their lived life experience. And that requires that we work on and develop effective relationships where we really understand and walk in the shoes of each other as practitioners, listen to each other. It's not enough to say that we're child-centred in our outcomes, in our service delivery. We have to be able to evidence that the child and young person's voice is at the heart of every decision, every discussion, every referral and every outcome that we're trying to achieve in children and young people's services in Scotland.